the gratitude and the appreciation we get from the staff is amazing. And it brings up the morale of the whole unit, of the whole staff and the unit and the hospital. So number one, it's professional satisfaction. Number two is financial satisfaction. I want my physicians to feel like they're getting reimbursed appropriately for the amount of work they're doing. And doctors are good with that. And I've been in the situation where I don't want to position any one of my physicians to feel like they're working so hard and they're not making the amount of money that they feel is appropriate for them. And that's my second.
The third, you mean like pediatrics?
Yes. You got to come work for me. And then thirdly is work-life balance. I have certain physicians that are young and they want to work and make a ton of money. I let them do that. I've got other physicians that don't want to work as much. They want to make some money on the side and they want to work 2 days a week, 2 days a month, whatever it is. And so we do that. The physicians kind of self-schedule. They give me their availabilities. All of my physicians are 1099. They give me their availabilities and then I put them in the schedule according to that. They want to work a lot, they work a lot. They want to work a little, they work a little. They don't want to work this day or this weekend or this day shift or this night shift. They don't have to. The other thing is, again, they're working usually from their home. Okay, so they have a home office. So when they get a break and they want to get a cup of coffee, instead of going down to the cafeteria and getting a cold or a bad cup of coffee, they go into their kitchen and make their own coffee. If they want to grab something to eat, they can do that. What I do lots of times is for nighttime, after sign out, I get sign out at 7. I don't sign into the hospitals until 8 or 9. I can actually go out and spend some time with the family if nothing's going on, and then come back and do my rounds. And then so you have the flexibility of being at home. Plus, also, some physicians do this is when they're going away, they're going to be at a conference or they're going to be on a vacation. I don't like to do it on vacation, but they can actually cover shifts when they are out about. Really, all they need is their laptop and Wi-Fi, and to be in a room that's HIPAA compliant, meaning that room that the door is shut, there's nobody else in the room with you.
Oh, you make it sound very easy, but I don't think it's that easy. I remember when I come to Florida, I have to pre-schedule with you a couple of months in advance.
Yes.
This day of the week I can come and see you.
Don't forget also, I'm the owner, so the buck stops with me. So if somebody calls in late or calls in, not many of my doctors' physicians don't treat call in, but I had one physician that he was busy at one hospital and his phone fell behind his desk and he didn't realize because he was busy with this one hospital and another hospital couldn't get in touch with him. So they called the backup, which was me. So at 1 o'clock in the morning, I got to get up and go and see these patients. I had this very rarely happened, but I had one physician didn't realize he was on call. And so that very rarely happens, but it did happen a couple of weeks ago. And then and it was a Friday night. So it was a good thing I was available. I was the backup. I did the night shift. Yeah. And then running the business, the medicine part is the easiest part out of the whole thing.
For you.
For the whole
person like you, for a person like you.
But getting a program started, its implementation takes weeks to months. Getting licensing and credentialing and training and getting all the parts and pieces together, and even talking with training the nurses to how to respond to certain things. So for example, now the nurses know before they push in the piece of equipment which we're attached to, the monitor is to tell the family, hey, this is Dr. So-and-so. He's a physician. He's licensed in this state. He's credentialed at this hospital. He's just like any other physician. He's going to come in. He's from Orlando or whatever, and he's going to be able to see all this stuff. So instead of just pushing a piece of equipment in with saying, what is this? They get a little preview of what we are and what we can do.